Hello everybody, today's topic is a communicable disorder, that is chicken pox, that we are going to discuss. Okay. Now this is caused by varicella zoster virus. This is caused by varicella zoster virus, which is under herpes viridae group. Now we know in herpes virus group we have many herpes viruses, and this is human herpes virus 3. The primary infection with this virus is going to give rise to this chicken pox. The primary infection with this virus is going to give chicken pox, which is mostly seen, the peak age is less than 10 years, the children are mostly affected. Many times what happens, it becomes latent in the neurons, basically in the neuron ganglias, and then on reactivation or even after a secondary infection with this virus, it will produce zoster, that is herpes zoster. Okay, we have herpes zoster ophthalmicus also. There will be the unilateral phase which is involved. The most important thing is the dermatomal involvement. The dermatome, it spreads through the dermatome, and patient will complain of burning pain sensations throughout that dermatome, and you will be having this typical lesions of the zoster along the dermatome. That is what is herpes zoster. Now for this chicken pox, it is a cyclical trend, that is around 2 to 5 years may you'll be having this chicken pox outbreak. Incubation period is 14 to 16 days. The very important thing about mode of transmission, it is airborne mostly, followed by droplet transmission. Okay, coming to the clinical features, a patient presented with fever and rash. Now this rash, the characteristic feature is it is centripetal in nature. It is centripetal in nature, that do not involve palms and soles. That do not involve palms and soles. Okay, and next is the feature is rose petal. So dewdrops on rose petal appearance. Dewdrops on rose petal appearance. Okay, centripetal means first the rash will start in the trunk area, then it extends to face and the limbs, and I told you in limbs the palms and soles are not affected. Okay, the most important thing about the rash is these are pleomorphic rash. That means at a time you will be having different morphologies of the rashes. The vesicular rash is the predominant pattern. So next, coming to the period of isolation and period of communicability in chickenpox. So a very important point regarding this rash is they remain infective till the time they are crusted. So we'll isolate the patient till all the lesions have crusted and the scabs are formed. Okay, and ideally this is 3 to 4 days for the scabs to form, and the patient, when the scabs are formed, patient is non-infective. So you have to isolate the patient till 6 days. Okay, around 6 days. What is period of communicability? Period of communicability is your 2 days before the onset of rash, 2 days before the onset of rash till 5 days after the onset of rash is your period of communicability. Period of communicability. The secondary attack rate, which is very high, around 90%, and the case fatality rate is very low, less than 1%. Okay. Now, supposing there is a female, the pregnant mother. Now, two important syndrome related to varicella. One is your congenital varicella syndrome. One is your congenital varicella syndrome. Another is your neonatal varicella syndrome. Another is your neonatal varicella syndrome. Okay, congenital varicella syndrome is something is because of the vertical transmission of the infection to the fetus. Okay, and that happens at around 12 to 20 weeks of gestation. That happens in between 12 to 20 weeks of gestation when the mother got the infection, and because of the vertical transmission the fetus will also get the disease. And very important, what are the features? You have microcephaly, microophthalmia. Okay, you have microcephaly, microophthalmia, low birth weight of the baby. There will be atrophy of the limb. Also there will be deafness, and the patient will also have, the baby will also have cataract. There will be cataract. Okay, also there will be zigzag cicatricial skin lesion. Zigzag cicatricial skin lesions will be present. Okay, these are the features of congenital varicella syndrome. The period is, remember, it's 12 to 20 weeks. What is neonatal varicella syndrome? It is different. because here what happens, the mother got infection, okay, this is delivery, so this is the time of delivery. So mother got the infection either 5 days before the delivery or 2 days after the delivery. Okay, 5 days before the delivery or 2 days after the delivery. Then if the mother got the infection, then it is what is your neonatal varicella syndrome. Okay, in this case you have to give varicella zoster immunoglobulin. So when a newborn that is born to a mother, to a female who developed varicella infection within 2 days of delivery or 5 days before delivery, is what is your neonatal varicella syndrome. Okay, in this here also you'll be having that zigzag cicatricial skin lesions. The most common complication that we'll be having is pneumonia and fulminant hepatitis in children. Okay, pre-exposure prophylaxis, which is given for preventive purposes, and we have vaccines. This is a live attenuated vaccines produced from Oka strain. 0.5 ml subcutaneous route में we give at around 12 to 18 months of age. Okay, it gives protection for a duration of 10 years. Please remember, if it is less than 12 years, okay, then we need 2 doses of the vaccines and with a gap of around 1 to 3 months, Okay, so that is what is for preventive purpose we give chickenpox vaccine, which is a live attenuated vaccine. That means it cannot be given in pregnant females. Okay, so in case of post-exposure prophylaxis, we have varicella zoster immunoglobulin, and there the indications are: number 1, pregnant female with varicella zoster infection. Pregnant female with varicella zoster infection. Next, I told you, where a neonate born to a female who has developed varicella infection within 2 days of delivery. Okay, or 5 days before delivery is your another indication, and also you can give in immunocompromised children. Okay, but what is important, you can never prescribe varicella zoster immunoglobulin with the vaccine. Okay, because they are chemically not compatible, they will neutralize each other. So never ever the immunoglobulin and the vaccines are given simultaneously at the same time. Okay, this varicella zoster immunoglobulin has to be given within 72 hours of exposure. If needed, can be repeated after 3 weeks. As I told you, BZIZ and varicella vaccines should not be given together as they are chemically not compatible. Sometimes what happens, if your BZIZ, that is immunoglobulin, is not available, in that case I can also use varicella vaccines as post-exposure prophylaxis in immunocompetent patients who are more than 1 year of age. Okay, I cannot give it to the neonate, to the infants, as well as obviously it's a live vaccine, so contraindicated in pregnant female. Okay, so these points you need to remember from chickenpox